I am so excited to be talking with Rena of Roots Healing or Acupuncture and Healing. I always want to put healing first, not acupuncture. I'm sorry, I don't know why. And that, but Rena with Roots Acupuncture and Healing, and so that we can get all of our questions answered about the benefits of acupuncture. So Rena, her own connection to acupuncture got started with her own diagnosis of endometriosis and inflammatory bowel disease. And acupuncture was one of the things that helped her immensely to manage life with a chronic illness by providing both symptom relief and emotional support. So I think our viewers would love to hear more about that aspect with it. So Rena pursued her master's in acupuncture at Maryland University of Integrative Health, and she continues her studies to specialize in supporting women who are trying to conceive both naturally and with the assistance of IUI or IVF. She's trained to help women suffering from PCOS, endometriosis, and recurrent miscarriage. And she loves following women through their pregnancy, helping to make those 9 months more comfortable. So can you guys see how much of a good fit she is to come talk to our community? So I'm so excited. So Rena, I know I gave a brief introduction, but please tell the group a little bit more about yourself.
Yeah, so I'm a St. Louis native. I left for a while and actually just moved back to St. Louis this past fall. I had my own private practice in DC and started my own family and decided it was time to come back to my roots. So I'm happy to be in St. Louis and was able to get my practice up and running last month. So I am excited to be supporting people in St. Louis now.
Wonderful. Well, we're glad you're back and you're bringing your talents back home to the St. Louis area. So I know most people have heard of acupuncture, but tell me a little bit more about kind of how that field developed and what's involved with it.
Yeah, so it has quite a hefty history. It goes back, there's a lot of roots in Taoist philosophy. And it's a compilation of a lot of traditions that were handed down over centuries. So dating back all the way back to 100 BCE, that's when we have the first piece of actual written information about acupuncture. And that book is the Wang Di Ne Jing, and in English, it's called The Yellow Emperor's Classic of Medicine. And this is, thousands and thousands and thousands of years old. And yet that's where all the meridians, all the points, needling techniques, it's all laid out. And that's how things have changed over time a little bit, but really the essence of the medicine and the theory and everything dates back thousands and thousands of years. It took a while for it to actually get to the West, quite a long time.
Can only imagine.
It was actually the 70s. And it was thanks to a member of the U.S. Press Corps who was given acupuncture in China during an emergency appendectomy. He was given acupuncture as anesthesia, which is quite wild.
Yeah.
And it blew his mind. He was there visiting in preparation for President Nixon's visit. And he was so impressed by his experience that he actually wrote an article in the New York Times about it. Oh. And that is when interest really started to spark in the US, was in the 70s. Okay. So it's new and fairly new, when you think about the whole history of acupuncture. So
I had no idea that was the history of it in the US.
Yeah. Wow. So
okay. Well, I think we all have a general idea they stick needles in me, and that might be the extent of most people's knowledge about how acupuncture works. So I know that's a very loaded question, but tell me a little bit about how acupuncture works.
So I want to also just step back just a little bit and say why somebody might choose to do acupuncture. Mm-hmm. Some of the great things is that, and I found it with my own health journey, because as you mentioned, I do have an extensive health journey, and acupuncture has been really instrumental in it, is that acupuncture is great at filling in the holes that Western medicine isn't always able to address. Mm-hmm. So, Western medicine can get us this far, and sometimes it can get us all the way, and it's just enough. But sometimes the collaborative approach is really kind of what seals the deal and fills in those missing pieces for patients. So I'm all about integrating the two. It's like Western medicine is one way to hold a patient. Eastern medicine's a different way. So you get to get like these different minds and different theories working together, which is great.
That's wonderful.
It's, a safe and drug-free alternative. There's really little to no adverse side effects. And what people don't know about acupuncture, many people don't know, is that it can be used as actually a preventative medicine. So patients don't actually have to have a problem per se to come in. It can be used to keep ourselves healthy and to make sure that we don't end up having imbalances.
Nice.
And we had really addressed the whole person with acupuncture, which really is what differentiates it from Western medicine, where, providers really specialize in very specific parts of the body or, and what I'm able to do with acupuncture is to address both the mind, the body, and one's spirit, their vitality, all in one. And we take all that into consideration because from an Eastern perspective, they all affect each other. So to loop back though to how do we actually do all this?
Yeah, I definitely want to know more.
Yes. So it's quite an extensive medical theory, but to kind of parse it down to the basics, we view the body as having the system of interconnected organs and meridians that travel through the body. So there's 12 main meridians that or channels that run through the body, and each of those meridians correspond to a different organ system. And what travels through these channels is what we call qi, which I think a lot of people have heard that word before.
Yeah.
And if you haven't, it kind of translates to energy. We're a very energetic medicine. Mm-hmm. So energy is supposed to flow smoothly through the meridians that are all connected in kind of like a one big circuit. And when there's a disruption of flow, that's when symptoms start to happen. There could be kind of like a backup of qi, and there's this excess accumulation of it in one area, and that could cause maybe a lot of pain for somebody. Or there could be an area that not enough is getting to, and the person has a deficiency, and we need to build them up. So the goal of acupuncture is to find these like patterns of disharmony that are happening within these meridians and organ systems, and basically create harmony so that symptoms can dissipate and somebody can be more comfortable.
Oh, nice. So how does that, if we take that more specifically into like a specific diagnosis? So I know you talked that you have a passion for helping people with fertility. So how specifically does it work in that field? And what kind of research is out there to support the use of acupuncture for something like fertility?
Yeah, so fertility also is something that's been like, and infertility and struggle to get pregnant is, that's been something for a very long, it's not new. And actually the earliest record of gynecological medical writing with regards to acupuncture dates back to 1500 BC. So the use of acupuncture to help with fertility, that's been around for also a really long time. Acupuncture can be really helpful in a lot of reproductive endocrinology that's happening these days. Now, obviously not happening back in 1500 BC, but acupuncture now, there's a lot of great research out there to promote the use of acupuncture to help support people going through IVF or IUIs. Acupuncture can increase implantation rates, and all of this is backed up by clinical research. Nice. It can increase the blood flow to the ovaries to boost like follicular development, increase blood flow to the endometrium. For people who are going through IVF, they know how important it is that their lining gets to a certain thickness during their cycle. And that can be sometimes an issue for women, and acupuncture can help with that lining. there's a lot of side effects to the drugs that come along with going through IVF, and acupuncture can really help to relieve the side effects and just make it a little bit more comfortable. I know personally through my own infertility experience that it can also be really high anxiety and a lot of stress involved with that process. So acupuncture can be a great thing to help reduce anxiety and stress. And when we talk about this, we also can't forget about the other half of fertility, which is our partners. And it takes two to tango. And sometimes it's not actually, it doesn't have anything to do with the woman. And sometimes maybe there's a male factor issue going on. So I always like to remind patients that, it might be time to bring their husband in, bring their partner in, and see if we can work with them, because acupuncture can help with sperm motility and morphology. So with regards to research, there's a very famous study that dates back to 2002, and this was published in the Journal of Fertility and Sterility. And this is a publication of the American Society for Reproductive Medicine, so it's very well respected. And there's a protocol in this randomized control study that was used for people who were going through IVF. And people were given a very specific set of points before their embryo transfer and after their embryo transfer. And there was the acupuncture group and then the control group. The control group was not getting acupuncture. Okay. And the acupuncture group had a 42.5% clinical pregnancy rate, success rate, whereas the control group had a 26.3%. So it was double, almost double, huge difference in success for those who had been getting this protocol. And this protocol has gotten really famous, and there are clinics that will provide an acupuncturist, on site giving this protocol.
Wow.
And it's fantastic that research like this has really helped to boost people's confidence in acupuncture.
Yeah. And
there's a little caveat that I think is really important to note, that some people just kind of miss with this particular study was used on embryos that were only 2 to 3 days old. Okay. So nowadays it's more common that they transfer 5-day embryos, that embryos that have been developing in the lab for 5 days. Okay. And there's a big difference in the development of an embryo on day 2 than on day 5. So given this actually is a little bit this is from 2002. The research is a bit out of date. That's not really the standard right now in clinics. So I know, at least for me personally, how I hold this information is, and basically how I treat in general, is that protocols, I'm not a protocol-based acupuncturist. The patients come in, and I think every patient, given their own set of circumstances, every patient coming in for IVF and fertility support, there's going to be a different reason for why they're there, a different root cause. And so while this research is great, again, I think it's just important to hold somebody as they are, as their own unique individual, and to give them a treatment that really is tailored and focused on their specific needs. Nice. Now, there are newer studies out there since that really famous one. And I just wanted to mention this other one that I think is just an overall, it's a systematic review. So it reviewed tons and tons of different research out there. This is from 2019. And this is published in the Journal of Gynecology and Obstetrics and Human Reproduction. And they reviewed evidence of acupuncture in the use of IVF for pregnancy outcomes. And over 4,000 women are a part of this compilation of studies. So it's a lot of evidence. Yeah. And the upshot of this review was that, in fact, acupuncture is beneficial to women, especially those that have poor ovarian reserve and who have previously been unsuccessful at attempts with IVF. Okay. So, it's just good research out there that supports that this is something that hopefully people should be adding to their mix.
Nice. Well, with that in mind, when's the best time for patients who are trying to conceive to come see an acupuncturist like yourself, and how frequently should they come see? Like, what does that look like?
So that's a little bit of like it's such an individualized answer.
Ooh, you're going to give my favorite one. It depends. That's my favorite answer too.
Yeah. Healthy parent, healthy baby. And everyone's going to come, you know, with a different background, a different history. So the time to prepare their body is going to depend really a lot based on their own unique situation. I say in a generalized, if I'm going to like give you a number, preconception care is ideal for about 3 to 6 months. And that is time to, a lot of, you know, people with issues with fertility, there's some kind of issue with their cycle. Maybe they have they have late periods, they have early periods, they have light flow, heavy flow, painful periods. And it actually takes, they say, 3 to 6 cycles with acupuncture to really be able to like to harmonize the period and make it more normal, which is going to benefit fertility. So I usually say 3 to 6 months, and, you know, patients come in and they're getting ready for their transfer next week, and we just meet them where they are, and we just, you know,
see what you can do.
What we can.
Gotcha. Well, let's skip forward a bit. So now say you have someone a pregnant woman who is coming in, and what type of things can you help with during pregnancy?
Yeah. So you might have heard, you know, that morning sickness is a pretty common thing for people to get acupuncture for. That is what a lot of people, I think, associate it with. And I think also there's just like a sense that, you know, all the different things that come up in pregnancy, it's just par for the course. Like, that's just the way it is. You're growing a human in you, you know, all this stuff's going to happen. Your body's obviously changing, and it will happen, you know, these things will happen. And acupuncture can be so helpful in making it a more comfortable 9 months. So the majority of ailments that really come up during pregnancy can be treated with acupuncture. That includes heartburn, hemorrhoids, threatened miscarriage is a big one, back pain, pubic symphysis pain, which I'm assuming you probably see a lot in your office. Insomnia, edema, anxiety, cramping, bowel changes, constipation can be huge. And then one of my favorites is turning a breech baby.
Really? Okay.
If the woman comes in at the right time, sometime between 32 and 35 weeks, baby's not quite big enough, it still has room to turn, acupuncture can do some wild things and help turn baby. And then
that's pretty cool.
Yeah. And then also just like preparing the body for labor, helping to relax muscles on the pelvic floor and give them a boost of energy that they're going to need to get through that time.
Wonderful. Oh, that's great to hear. I didn't know about all the different things that it could help with that way. Now, again, skipping forward again, woman's delivered, we're postpartum, and you're talking to the population that's near and dear to my heart, where we're helping them with things like sexual issues and incontinence and prolapse. So what kind of support can acupuncture add in that 4th trimester?
Yeah, the 4th trimester, I feel like, is so often forgotten. I think it might be harder than the actual pregnancy.
Yes, definitely.
That's everyone, and you might not have much time to come in, but in terms of help that we can provide for women, breastfeeding issues is a big one. Engorged breasts, lack of milk supply. Maybe somebody even wants to stop their milk supply because they decided the formula is going to be a better option for them, but their milk supply is still coming and they want to stop it. We can use acupuncture to help stop that flow. Fatigue. There can be a lot of blood loss that happens during labor, and that can cause a lot of residual fatigue for women. So acupuncture can be great for just energy levels, persistent vaginal discharge, which can be an issue after birth, postpartum depression, and urinary incontinence would all be really great reasons to come in for acupuncture. And even better if it's paired with some pelvic floor therapy.
Nice. That works. Wonderful. Well, this is all great information that you're talking about on how it can help us out. What should, because a lot of our audience is local to the St. Louis area, but some of them aren't. So what should patients look for when they're trying to locate and choose an acupuncturist?
Yeah, so a great resource is to reach out to the NCCAOM, which is the organization that certifies acupuncturists. That's where they create the boards for acupuncturists. And nccaom.org, you can go on and search by zip code to find a board certified acupuncturist. It's definitely like a great place to start. And I think it's really important for patients to find someone who they can have really good rapport with. Like, you are going to spend, acupuncture is not like a one and done type thing where you go in once, you go in 2 times, 3 times, and then you're done. It's often a journey. And so I think it's really important for patients to find someone who they resonate with and who they feel, they're being seen and heard, and they feel safe with and comfortable. Wow. So word of mouth is always also good to, ask around and see who's recommended in the area. But really the best place to start is to look at nccaom.org. You could also look up your state organization. All states have like an acupuncture society. You can find members of the acupuncture society to find people who are certified in your area.
Wonderful. Well, great. Well, I know we just spent a decent amount of time talking about the pregnancy and postpartum part, but we have a question from the audience of, I'm past childbearing age, but what are some of the common things that I would potentially see an acupuncturist for, but it's not related to pregnancy or postpartum?
Yeah. So. Menopause. Hormones change. Acupuncture is great at regulating hormones and night sweats, which if that's something that you're suffering from, acupuncture can help to reduce that, and any of the other issues that might come along with menopause, just to help that be a little bit more of a smooth ride. I always say, with any issue or ailment or something that's going on with patients, often, it can be a roller coaster where you're going these ups and downs, and you have these like peaks and valleys of good and bad. And acupuncture can't always, your body's still going to go through this process, and acupuncture is not going to make the process stop. We're supporting the natural human flow and what needs to happen. But what we can do is make it so it's a little bit more of a smooth ride. Nice. Less turbulent, less stressful. I talked about how acupuncture can be great emotionally and mentally. So often it's helping patients relate to what's going on to them in a different way. Okay. So it's not such a source of stress and burden.
Mm-hmm. When you gave your visual, it made me think of it's like riding the kiddie roller coaster instead of riding the screaming eagle. It's like, okay, I just want to do something nice and easy. I can balance this out a little bit versus all of the highs and lows.
Yeah. And that's what my first career was in graphic design. I haven't always been an acupuncturist. Okay. And it was my diagnosis of IBD and endometriosis that led me to become a patient of acupuncture. And it just blew my mind how, and if anyone's listening and they have experienced IBD or endometriosis, it can be terrible. And again, for me, it's just like my relationship to my disease, my ability to handle it with just more ease and grace. It really helped make it an easier ride. It's not gone. It's part of me. It's going to be here, but doing a lot better because of the support acupuncture has given me.
That's wonderful.